stay open. And especially proud of all the work that our medical community has done through this pandemic. Really looking forward to hearing from Charles this morning. I hope you enjoy your breakfast.
Well, big thanks to Synovus, our series presenting sponsor. We appreciate y'all very much. Thank you, Ron, for that video. Doing welcome here this morning. I'm Shane Outlaws, the chairman of our Robbins Regional Chamber of Commerce. And didn't know before this year what it was like to be a chairman of a chamber. And after this extremely weird year, I still don't feel like I know what it means to be the chamber chairman. But fortunately, at least, amen, it wasn't as weird as last year was. So we're getting somewhere. But again, appreciate you being here. I'm going to say something we said a few times. Welcome back to Eggs and Issues. We've had a number of breaks in this programming, but it is good to be back in person. Proud of the Chamber's commitment to, even through cancellations and things, to continue to bring timely programming. It's been quite a couple of years for the Robbins Regional Chamber in April and all the gang. So now we'll go ahead and start out most appropriately with a word of prayer and our pledge. I'm going to call up Michael Collins with Total Computer Solutions to lead us in that.
Please stand if you're able. As I pray this morning, I'd like you to consider just what if it's true that we're all created in the image of God? How would that change how we treat one another? So let's bow together in prayer. Father, we humbly bow before you this morning, turning to you for the wisdom only you can give. Father, we thank you for the community leaders gathered here this morning. We thank you for this facility in which we can meet. And we thank you for the glory that you've shared with us. And when we consider the heavens and all that is contained in them, who are we that you are mindful of us? But you have crowned us with glory and honor. You have made us a little lower than the angels, and you have loaned us your very image. And Father, give us the grace this morning to demonstrate our faith by accurately reflecting your image to this world around us. Give us grace to love our neighbors and our fellow image bearers, both male and female, as you have created us and called us to do. Help us to redeem this community for your glory. And may your will be done in and through us this day. We pray for the food that we've benefited from this morning, that you would bless it to our bodies to your service. We pray all this in the matchless name of our faithful Savior, Mediator, and King, Jesus Christ. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You can be seated. Thank you, Michael. Well, as we continue, I want to thank, we've done it once, but we'll do it twice, 3 times, however many times we need to. Thank our sponsors, and again, our presenting series sponsors, Synovus. We also want to thank our host, Houston Healthcare, for this wonderful facility. And today's session sponsor, that is Parish Construction. And at this time, I want to call up Jeremy Bennett, Vice President of something or other. Come forward, please, say a few words.
I keep it short. Looking around, I thought about 3 things that made me excited this morning. One, to be back and to see the number of people that are actually here and the leaders in the room that strive every day to make our community better. And thirdly, I get to go now, not after David Danzy, because I don't know that I can deal with that much charisma this morning, early in the morning. But seriously, I was thinking about it last night, and we've been talking a lot around our office about exceeding expectations and how difficult that is over the last couple of years with COVID and everything that's going on. And I see Mr. Briscoe's got a lot of his team here, and I'd like the room to give them a round of applause, because for the last 2 years, they have exceeded this community's expectation. Yep. through putting great information out there, hard work, dedication, and compassion for the community members of Warner Robins and Houston County. So with that, we say thank you.
Good words, good words. Again, thank you to all of those who have served these last couple of years in that unique role. We do thank again today Parish Construction for sponsoring, so we kind of highlight and hear from Mr. Briscoe regarding some of these things, and it's going to be a good morning. And I know she wouldn't want to be ranked up with our healthcare professional, but someone else who has exceeded expectations is our Chamber CEO, April Bragg. And at this time, I'm going to call her up to continue our program.
Good morning, everybody, and welcome. Thank you so much for being here at Eggs and Issues. You may have noticed in my list that I have a little attachment in my mouth and shoes that don't look like what a chamber CEO normally wears. And I'm going to flip the script on what I plan on sharing this morning, because I shared this message with our teachers back in July at opening session. And Charles is going to focus a lot on this today with their newest campaign, #HoustonHealthy. But our healthcare workers, all of you in this room, were faced with challenges over the last 18 to 20 months that none of us was prepared for physically, mentally, organizationally, or otherwise, right? And many of us took on hours and stresses that probably weren't ours to bear, but when nobody else was bearing them and nobody knew what to do and there was no roadmap, we knew that not doing was not an option. So we at the Chamber continued to press forward, our healthcare workers continued to press forward, our businesses continued to press forward at all costs. For me, the cost was my health, so I was sitting at the honorary commander event on base about a year to the day from today, and left there in the back of an ambulance after experiencing debilitating vertigo. And the heroes at Houston Healthcare were able to take care of me and get me back in fighting shape. But turns out I developed TMJ due to the stress of everything I was taking on. So you will see me for a long time in these shoes, but I will not be wearing this brace for much longer. But that's why you're going to hear from David Danzy in the hot seat today, interviewing Charles instead of me, because I know you probably won't understand this. But you all know we had to postpone 4 of our Eggs and Issues breakfasts in order to just be the example we needed to be in the community as it went with gathering. Between this and the museum, there were restrictions on how many people we could have in one place, and we know and we are very thankful and do not take for granted that when we host an event, our community people, our leaders and business champions show up and show out. And so to host 200 people in a room really wasn't possible until this past month. And so we were very grateful to be able to get 2 Eggs and Issues in for the remainder of 2021, which is still really hard to say. Does anybody else still think it's 2020 and next year is 21? I keep messing that up, whether I'm writing it or saying it or whatever. But we only had 2 open slots so that we could space these appropriately, today and then December the 9th. Well, today, in addition to being our return to Eggs and Issues, is also a special day because it is both Charles Briscoe and Chairman Tommy Stallnaker's birthday. We're going to have a chance to sing in just a second. So, obviously, healthcare. Of the 4 breakfasts we had to shift, healthcare, critically important that we hear from our chairman, our hospital CEO. And this year, 2021, is the 200th anniversary of Houston County, as you see on our signage here, and we knew we wanted to honor that and celebrate that in this year. So I was like, oh gosh, how do we decide who goes first, which is more important? They're both very important people, they're very important topics. What are we going to do? And so we did what any other organization would do. We just let them handle it like gentlemen, so they arm wrestled over it. Well, clearly Chairman Stallnaker won, but he's still recovering, so that's why Charles is going to be in the seat today with David presenting our program. But before we move forward, I would like to ask that all of you join me in singing Happy Birthday, and we're going to have the words up here, so you know it's going to go Charles and Chairman. Got it? All right. Happy birthday to you. Happy birthday to you. Happy birthday. cautionary tale. Hashtag House and Healthy is gonna be something that I hope that in addition to our tribute to our amazing healthcare heroes that are here today, is something that you latch onto and your organizations find ways to implement, because guess what? Prioritizing your work over your health is stupid, because you can't do your work if your health is not in place. So let my experience be a cautionary tale to you, and also be encouraged by the fact that there is only one you. So whether there's a substitute in your classroom if you're a teacher, or whether there's somebody else that's covering for you while you're out, they're not you. You are what make you awesome, and there's nobody that can replace that. So do what you can in your daily lives to take care of yourself physically, spiritually, emotionally, all the things, because we value and appreciate the uniqueness that you bring to our community, your organizations, and the chamber each and every day. Now Charles and David are going to come forward and make a presentation. I do know some of our guests are going to need to leave early, including Commissioner Byrd, but it has been excused by the chairman, and you can pay me later, Commissioner, Chairman, for saying that. Please join me in welcoming David Danzy and Charles Briscoe to the stage. You can't get rid of me that easy. He's not even on.
I can't believe you said David was in the hot seat. This is the hot seat. I was going to say that.
Can y'all hear me? No, I'm just kidding.
Hello. Hey.
I think you're on one, Charles. You might make also.
So it takes a smarter person than me to get this thing working. Whew. What a year.
I tell you what.
What a year. Before we get started, Charles, I think you've got some special guests and you want to do some recognition. So before we get started, won't you?
I do, thank you, and appreciate you filling in the chair today. There's no telling what we're going to talk about.
Sorry, Charles.
And Ron, I love the Georgia building in your office. Yeah. All right, so Jeremy, Vice President, whatever, which is I kind of covered this a little bit, but we did want to do something special today. So when we had the first, I guess the only exit issues this year earlier with the local delegation, I was sitting here and it occurred to me that we had this opportunity coming up. Hopefully, we did get to it. And for 20 months, I've been going around the community, and you guys have been patting me on the back, and members of the executive team, you've been patting them on the back and saying, great job, and very much love it. And believe me, we've done everything we can through internal communications to get that word to our board, to our medical staff, to our employees. You know, cumulatively, that's close to 3,000 people. But we just can't touch 3,000 people the way you have touched me and the executive team over 20 months. So here's your chance. We don't have 3,000 people here, by the way. For those of you that went to Auburn. But we do have, and I'm going to ask you to stand up here in a minute, and this is your time to shine. For what you've given me and the executive team for 20 months, we have members of the board here. Members of the board, if you would stand, and that includes system board, hospital board, and the authority, if you wouldn't mind standing for just a second. We have members of the executive team, if you guys would please stand. And then we have representatives from every department within Houston Healthcare. So if you individuals would please stand. Woo! Now it's your time to welcome. Let's hear it. Thank you for all you've done. Please, this is your chance to tell these people what you feel about them. It's what you told me for 20 months. They need to feel it, and I appreciate this little moment. We do have, you noticed, probably more cameras in the exit issues than normal, but we intend to take the same sentiment with this video to our organization, and so we can share what the community leaders feel about our organization, about our employees. So thank you for this little moment this morning. Thank you to all of the employees, the board, executive team. Just can't even describe what we've been through. We'll get into some of it here, but battling hard, doing everything they got to do, and we continue to do it even today. So thank you for that moment. David, you're not in the hot seat.
Get you back in the hot seat. Thank you again.
This was already a little warm.
That is a great opportunity that they've had to be able to express themselves. But we also want to make sure, and I think we're going to announce it, you'll have an opportunity to do a video at the end to show your love and support. So thank you for all y'all do. We really appreciate it. We all have family and friends who have been touched by the work that you've done. I know it seems tireless, but we really love you for what you've done. So let's get into it. All right. Let's talk a little bit about probably what's the first thing on everybody's mind. Give us an update, Charles, on COVID, how it's still impacting the organization, and then also how has the organization opened back up?
All right. So, and I will commit to you, the 45 minutes we have here, this is not going to be 45 minutes of COVID. I know but it is important that you know where your local community and health system is currently. So this morning, it's actually today at a high level an improving situation. And we'll get into some of the finer details in a minute. But this morning we have 7 positive patients. As a peak during this 4th wave, as we refer to it, we had about 145 positive patients in our health system. I think the peak down at Perry was around 30. That's a 39-bed hospital. And the peak at Houseman was somewhere around 120, I believe, was the number, the peak at Houseman. So we've just some perspective on where we are today and where we've been. And all of that ramp up and ramp down, if you will, has occurred roughly since the end of July. So it definitely was an event, a wave that hit us. Of those 7 positive today, there are 3 positive in the ICU. There are, I believe, 1 this morning on a ventilator. And what I want you to understand too about this wave, some of you have heard me say this in the community, it's not just the number in this 4th wave. It's the makeup of the number. It has been incredibly resource intense in that it's heavy critical care and heavy mechanical ventilation. Previous waves, we still had critical care patients, we still had people on vents, but as a percentage of what we saw in this 4th wave, just overwhelming. And just forgive me for a second while I want to tell you accurately on these numbers, but the peak critical care, just critical care, 80. Okay, we're a solid community-based hospital system. We have 18 ICU beds at Houston. We have 4 at Perry. And the way healthcare works is you obviously you apply to state for license for certain services to provide, and you scope your services, your capacity, much like all of your industries. You build your infrastructure to meet your need, and we have schools to meet the growth and the children in the community. So we have an 18-bed ICU because that's what we expect in Houston County for critical care patients. 80 critical care patients was a peak. Now, so a little bit about that. On average across the hospital, we depending on where you are, ICU, we're going to try to give 2 patients to each nurse. That's sort of the standard in the industry. You get out more of a basic medical surgical, you're going to be 1 to 5, 1 to 6, depending, and even some go to 1 to 4. So if you just blend all that together, you're roughly, 4.5, 5, maybe 6 patients per nurse. And again, keep in mind, 18 ICU beds. That's our plan. That's the way we're built. We typically run around 16 census in the ICU. So that's 8 nurses. Again, staffing is more complicated than that, simple math, but just for the crowd this morning, simple math, 16 patients, you need 8 nurses. And these aren't average nurses. These are nurses with critical care training, experience that they're bringing to the table. So when you go 80 critical care patients in your hospital, the 8 you expected on any shift is now 40. So when you hear us in the industry and at your local health system telling you the impact on your system is significant, the nursing burden is significant, we're struggling to find nurses, that's really how it happens. You go from an 18 critical care to 80, you can't get there. It's not within the normal range of variation of what we try to do. So that is how this one was different. And then you add on to that the vents, and the vents typically ran about 2/3 of that critical care number. So very resource intense, and more of it than we would ever even potentially plan for. So improving situation. Unfortunately, during the 4th wave, we did see deaths at a higher rate. Just in the 4th wave alone at Houston Healthcare, we saw 128 deaths since the end of July. So this is here, this is real. We're not making this stuff up. We'll get into the vaccine in a minute, but it has been, and I know you guys have heard this, it is an unvaccinated situation. At any given moment, the patients we have are 85% unvaccinated. The mortalities are 90% unvaccinated. And, you know, we've been in an incident command center mode since mid-March of 2020. And we've started virtually every morning with that report of where we are on COVID. And about 5 minutes into it, we get to the part that really we have to go through, but I hate it. And that's the deaths. And I can tell you in the 4th wave, generally, this is what it sounds like. And I'm kind of leading into the vaccine if you can't figure it out. But those vaccinated deaths, and they do occur, they are less than 10% of what we've seen. They tend to be of significant age. They have comorbidities like most everybody in this room. But they also have significant sort of life-changing, life-altering chronic illness. So they're somewhere in the treatment for some form of cancer. They've had significant neurological issues. They've had significant cardiac issues. And they succumb to COVID. That's what the vaccinated fatality sounds like. The unvaccinated is 20 to 60 years old, has anywhere from 0 to 2 or 3 comorbidities, manageable comorbidities. I would venture to say 85% of this room probably has a comorbidity and might be, or might have this morning gotten up and taken a preventative medicine for that comorbidity. Manageable, 20 to 60 years old, otherwise very healthy. Many productive years left. No one wounds. And that's what the unvaccinated death sounds like. So that's what we're seeing. The numbers, though, they are improving. We are seeing one little concern. I was going to show you today, but I couldn't confirm my theory, basically. So bear with me. You can go out to the CDC website, and there's a beautiful map of the United States. And it comes out, I think, every 7 days, and it's color-coded based on use rate, or case rate of COVID. So per 100,000 citizens, what does the case rate look like? And marketing did a good job of putting this together, but again, I couldn't quite put my theory together. But if you watch just report after report and watch the color coding shift around the country. You know, in mid-July, we were on the lightest colors here in the Southeast. Everybody was happy, you know, football season was coming. Go Dogs, all that kind of stuff. And then late July, Florida, Louisiana, Alabama started changing. And Georgia started changing. And over a matter of 2 or 3 weeks, the entire Southeast was the darkest blue you could imagine. That's the color on the graph. The darkest color, the darkest shade you could imagine. And as I've just explained to you, over, you know, through October, those colors lightened and sort of moved on the rest of the country. Here's the point. It appears it's not a uniform wave, so it didn't leave the Southeast and go right on up the East Coast or back to the West or wherever. It kind of went up the coast to where the vaccine percentages are a little higher and just jumped all the way out to the Dakotas. In places like that where the vaccine rate looks more like the Southeast. It's not to say they didn't have some color shading in the Northeast or far West or some other areas in the country. But again, I'm not sitting here today to tell you this is a firm theory, but it appears to me this is moving through the country, and when it runs into a high vaccination rate, it goes somewhere else where it can find low vaccination rates. And what's concerning about us, to us, is the last report. The state of Alabama turned a darker shade of blue in the past 7 days. Let's hope that's just Alabama being Alabama, but I don't know. It may come here. We've seen anecdotally the past couple of days a little tick up in our positivity rate, a little tick up in our testing. Nothing like I've just explained to you, but we are seeing maybe that this is coming back. So, improving situation today, but some concern. To the opening up, we're fully open. We still have some visitation restrictions and some masking restrictions based on OSHA that we have to live and abide by, but our visitation other than that is wide open. So we feel, and we've always felt throughout this, that visitation was the key to everyone's health. And so we have opened up, once we consistently were under 15 cases, we opened back up. But you do still have to check in, you do still have to wear masks and those kind of things. And at this point, that's driven by OSHA. So surgeries are back open at both Perry and Houston, all types of surgery. The cath lab's back open fully. So we are here for you. Nursing is recovering, I would say. Respiratory is recovering. Those two disciplines really took a hit, but they're doing well. We're able to handle the census we have today in a normal sort of staffing arrangement. So that's where we are. We're still tired, but we're hopeful we're going to see a brighter future.
Well, you're tired, and rightfully so. I just wanted to comment too. The nursing shortage was there even before COVID. So this just exacerbates the problem. So thank you for taking us through that. At this rate, we should have one more question.
It worked. See how you're doing.
No, let's talk about it. And you touched on this. You know, there's a lot of focus on the flu vaccine and COVID vaccine right now. Why are vaccines important?
Well, I mean, bottom line, it's all for your safety and your overall well-being. I mean, you go to your doctor, he's going to tell you need certain vaccinations. You know, I'm of that age where last week I had to go get a shingles vaccine. I have no idea. I have no idea. Don't know why. The doctor told me to. You're at that age, go get it. So I went and got it. And I was a little sick the next day, or felt sick. I did it because the doctor told me. It's part of being a healthy individual at a certain age. So I did that. The flu, same thing. I mean, you need to get the flu shot. We never know what the flu is going to look like. That is different. People say, oh, the flu and COVID, same thing. Not at all. But on this point of a needing to get vaccinated, it is the same thing. I can tell you last year we saw virtually no flu. You think about what we were doing. We were washing our hands like we've never washed our hands before as a society. We all had a mask on, whether you liked it or not. I'm not here to say we all need to be masked up all the time, but we all had masks on. We were all kind of staying away from one another, and we had no flu. So those best practices, again, not telling everybody to wear a mask every day, everywhere, but flu season, there's some good techniques that the nurses will tell you we should have been doing all along. Just being a little more careful with ourselves when we're out and about and doing things and just living our lives. So we saw virtually no flu last year, but the COVID vaccine, I could take the rest of the 30 minutes on this, but I won't. It is essential that we get vaccinated. We are today, as Houston County, I believe 43% fully vaccinated. If you look at those that have gotten one shot at least, I believe we're at 47 or 48%. So ultimately, if those individuals follow through with the two-shot vaccine, we'll be around the 47%. But I will tell you, for your personal health, the numbers I just shared with you, the graphs y'all seen online that we've done, if that's not compelling enough to go get a shot and take care of you, I don't know what is. That's your local hospital, that's your local community. So please go and protect yourself. The other, this is a chamber meeting, right? So let's talk about business. In my opinion, economically, we're not going to come out of this until we all get a very high vaccination rate. I believe ultimately from an economic development perspective, when businesses go and look at places to relocate or places to expand their infrastructure, it's reasonable to me that they're going to ask the question, one, do you have adequate workforce? They're going to ask that all the time. Secondly, do you have a healthy workforce? And at 43% vaccinated, if I'm looking to invest millions in a community and I see a 43% vaccination rate, I'm going to wonder, am I going to have a workforce that's going to allow me to get the business return that I need for this investment in this community? So from a business perspective, it's a smart thing to do. Okay? We've got to vaccinate ourselves. For your healthcare system, there was a comment on my notes here about our financial well-being, and I'm not going to go into all of our financials, but the COVID hit to our organization and every organization in this country is significant, overwhelmingly significant. And I'm not sure if some health systems across the country are going to be able to survive. So back to business development. What's the other question companies ask when they come to an industry? Do you have health care? Okay? You have a great healthcare system, but because of COVID, it is struggling financially. So get vaccinated so that we don't have to shut down, so that we can continue to have those services that we've scoped for a normal day in our community. The EMS can be there to respond in a timely manner. The nurses can be there. All of our units can be open because we have the capacity to staff. We have the resources to buy equipment. It's a solid healthcare system. It all comes back to economic development. There's growth, there's jobs, there's construction, there's everything that goes on with a healthy economy. I believe the vaccine plays a key role to that. And, I'll tell you this, I don't sit here before you today as an epidemiologist or scientist that can tell you exactly what this virus is going to do. But I know the virus is going to do what it wants to do until somebody or something stops it. Okay? So, as I've said in some other forums, if the vaccine running its course is a ball game, the vaccine's going to win if we're unvaccinated. It will freely do what it needs to do. It will mutate, it will move, it will do what it needs to do if we don't stop it. So how many of y'all got up this morning and your feet actually stayed on the ground? You didn't float away. That's an easy question. That's not a trick question. That's
I was
not a
scared
trick
to answer
question.
that.
Again, for the Auburn people, if you are sitting in a chair, the answer to that question is yes. My point being is gravity, right? We trust gravity. We get up. It's a given in our world. It's a scientific given. You know, another given in our world that I've used in this vaccine discussion, people, not to get political on vaccine, but it's FDA approved. Again, I don't want to ask for a show of hands to embarrass people, but I bet you most of the people in this room took some sort of medicine this morning to take care of some comorbidity or some concern. Even if it was over the counter, maybe the runny nose in the fall. FDA approved. How many of you, when you went through the food line this morning, actually stopped to say, what sort of government agency is involved with the preparation of this meal? Nobody. It's a given. It's not a science, but it's a given in our life. The FDA has approved this vaccine and has said it keeps you out of the hospital and it keeps you alive. Doesn't mean you won't get COVID, but it keeps you alive and out of the hospital. It's time for us to get over all the nonsense, all the political vitriol, all the nonsense that we hear on social media, see on social media. This is FDA approved. It works. I just rolled through a bunch of disappointing and depressing numbers in your local healthcare system. It's time to get the vaccine. And it's time for Houston County to be at 80 or 90% vaccinated. So I would call on each and every one of you as business leaders to do whatever you got to do in your organization, in your personal sphere of influence, to push this vaccine and get people vaccinated, because it's the only way we're coming out of here. Or I'm going to tell you, I'll be here next fall telling you how many people unvaccinated are no longer with us. We do not need people of any age dying in our community when there's a readily available, FDA-approved vaccine to prevent it. Bottom line. And listen, I'll even just, I'm preaching now, I'm sorry.
I was about to say, go ahead, Reverend.
On certain items, I may be as conservative as anybody in this room. Okay? And there are questions I'd like to see answered in our society related to the COVID vaccine, related to the COVID virus itself. But I'm not going to let myself get sick and potentially go to the hospital and die waiting on answers. So even if you are kind of in that boat, don't put yourself at risk waiting on answers. We can get the answers. The answers will come out later, but just protect yourself now. Because I don't want to see you come in and come to the Regeneron clinic, which, by the way, is emergency use authorization. Guess how many times we gave Regeneron since the end of July? 4,000 times. So we won't take a vaccine, but when the doctor says, you got it, 4,000 people will run over here and get Regeneron, which is emergency use authorization. It works, by the way, but we don't want to go there. We don't want you to even get it. And because once they say you got it, vaccine's off the table until you heal up and you can get it. So please, get vaccinated. I'm sorry.
No. I feel like we should have a prayer or something coming to Jesus. But
we don't pass the plate.
Yeah. and you touched on our next question. I don't know if there's anything you want to add. It's really interesting, the Regeneron Clinic and how it's impacted the society as a whole. I don't know if you have anything else to touch on that, or we can go on to the next question.
Just to say, it's a lifesaver for us. We did 4,000 treatments. So if you just assumed, there's no science on this that I've seen, but you just assume 10% of those people would have had some sort of access point to the hospital. In addition to the numbers I gave you previously, it really, as overwhelming as this was, it really kept a whole bunch more out of the hospital. So it works, but again, we don't want that to be the front line of defense. We want the vaccine to be the front line of defense.
Well said. So, even through COVID, healthcare has changed. We kind of touched on some of those topics. How have you all grown over the last 2 years?
Yeah, I tell you, our marketing team struggled to put this together. Just not struggled to remember what we did, but really just to kind of go back, because it's been 2 years. I think we did this last year, April, but it was virtual and it was all COVID. So we've missed some grand openings and ribbon cuttings and things that we've done just because we couldn't have gatherings. But so really, this is kind of going back to 2019, but some things of note. when we were with you in 2019, we had just bought a Da Vinci robot. And that has taken off so well for our community and for our medical staff in our hospital. We actually bought a second robot during COVID, even with the surgical shutdowns. So we are now full throttle with general surgery procedures on the robot. We now, at this point, have 3 OBGYNs trained for robotic GYN procedures. We are hopeful that in the future we will have a urologist that will be robotically trained and ability to do robotic prostatectomies.
Charles, I don't want to interrupt you. So with a robot, does that mean I can have practice? No.
They got a model they'll bring to the mall and you can play with it. You can like pick up
Like
little,
picking up the toy.
you can pick up little Legos and things. That's more for you.
Okay.
But it's a wonderful technology. As I said in 2019, we're a little late to the game, but we are there now, and our surgeons are taking to it, and so is the community. And it's a really nice growing line for us. We've been able to also get in some bariatric procedures with that. So good news there. We had some additional services to our med stops right before we got into all this. We had built out and started pediatrics at our Lake Joy med stop. And we hired some pediatricians there. Just fantastic. It has done everything we thought it would do, to the point where when we opened our new med stop in Bon Air, we had pediatrics there. So it's really been a nice addition to that urgent care service line. We had just started our telestroke program at that time, back a few years ago, where we were able to work with the Grady Marcus Stroke Network, where you come into our ER and you get a remote visit with a neurologist at Grady, and they can immediately say, diagnose over telemedicine what your condition is. And most of those we're able to treat locally with our own neurologists in our own hospitals. But through that capacity, we can transfer to higher level care as needed. And we've sent folks to Madison, Piedmont-Macon, we've sent to Grady, Emory. I mean, there's no sort of one path that you can take there, but we are able to take care of a good number more stroke patients today than we were when I was last before y'all a couple of years ago. And actually that program has grown to where we received DNV stroke certification in both of our hospitals. So we're a primary stroke center at Houston and acute stroke ready at Perry. So it's all telehealth. You come to Perry, they can get you a certain level of care, and at some point you go to Houston. Same thing at Houston, only Houston's got more capability, more physician capacity to take care of stroke care. So that's tremendous growth for us. And, right at that same time, related to the stroke program, we implemented the helipad in the back of Houston. It's 2 years old now, but we never actually got to have a ribbon cutting for the helipad, but that also is kind of played along with the stroke center. We've also won some American Heart Association awards for stroke care and our processes related to stroke care. So that is your local team that went together, sat down 3 or 4 years ago, saw the data of stroke care, what happens in Houston County, what treatment is done for Houston County people, and they said, boss, we can do this. We can do it better here, we can do it quicker here, we can do it more efficient here. They proved their case. We went to the board funded it, and now it is a growing service line for our health system. So fantastic work there by everybody involved. We brought on some surgeons and some physicians under our employment. We typically only employ physicians if our local physicians are either not at a point of growth or just not interested in growing or adding new physicians, or if it's a service line that we don't have in the community, that we need to add to the community or we need to stabilize in the community. So that's when you see Houston Healthcare employee physicians, that's generally what's happening, and that's why it's different than independent physicians. We love them both. It's not a preference of independence versus employment. We love them all, and we want to work with all of them to grow capacity for our community. But we've added some primary care down at Perry. We've added urology, behavioral health We have a new ENT right across the hall here. We've employed gastroenterology, urology, and a vascular surgeon as well. So it is a growing group, but again, it's really more of a necessity where somebody's got to bring the resource to the community, and then the hospital has to step up and kind of secure or bring that to bear. So that's just very high level. Some of the things we've achieved over the past couple of years. There's a lot more into that, obviously with COVID, but very proud of the team to stay focused on strategy when we have the ability to stay focused on strategy. We are growing, we are seeing good things, but if we could just get the virus out of the way and we can get a consistent run. Just to put some perspective on 20 months with COVID now, we've been partially or fully shut down in surgery and all other procedural areas 9 out of those 20 months. So think of the highest revenue producing whatever in your business and shut it down 9 out of 20 months. And that's the financial impact on our health system. So we've grown even with that.
A lot of work. A lot of work's been done. I know you could drill down even further, but yeoman's work on everything that y'all are doing over at House of Healthcare, we really do appreciate it and doesn't go unnoticed. You mentioned earlier about the med stop in Bon Air that moved from Houston Lake. Remind us where it's located and how that's going.
Yeah, so it's over in the public shopping center off of 247 and Old 96, I guess we call it. It's been there. Again, time flies. I couldn't tell you when it opened, but it's been probably a year now or 10 months. It's close to a year, Kevin. my team doesn't like CEO math.
Some people always have to be right.
Sean just gets mad when I say it's about $5,000. He goes, it's $4,850. Well, that's about $5,000. So anyway, so it's been 10 months we've been open. It got off to a little slow start because of where we were in January, right? In the third wave, which was January, the med stop, it's just different the way the COVID has hit. People weren't rushing to the med stops in the third wave. So the opening was a little slow. I can tell you in the fourth wave, people were flocking to the med stops. In August or September, we normally run in a non-COVID month at our med stops around 6,000 med stop visits. In August, we saw over 10,000 visits. So when you talk about the Regeneron clinic and you talk about the testing clinic we propped up over here, it was to save those people because those hard-working folks in those med stops just couldn't take care of the flow that was coming in the door. So to be able to say quickly, positive test anywhere, go get Regeneron, help save the med stops. Same thing with testing. So they're back to normal now, but that med stop is well established now, thanks to that's actually a benefit of the fourth wave, I guess I would say. It's got pediatrics, it's got similar hours to Lake Joy and the Pavilion. We moved it, frankly, because what we saw on 127, the majority of the use of 127 were from the Bon Air zip codes. So it was a targeted move, you would say. It wasn't just, hey, we think we need to go over there. And we're still going to have services coming back into that 127 building today. We've got a nurse practitioner that will ultimately have 2 primary care in there with her in the old urgent care location for a primary care access point. And then the other side, we have leased to an orthopedic group.
Nice. That's somewhere that you don't want to go, but when you go, you want to make sure it's there and it works. So thank you for having it there for us. I want to jump to a different question because I think a lot of people have probably seen these billboards around town and the videos for #HoustonHealthy. Would you talk a little bit about what that is exactly?
I will, and marketing team, forgive me, I'll buy you lunch for this if I mess it up, but this didn't roll out the way it was supposed to roll out. And that was really my call. #HoustonHealthy, if somebody will bring that board up here, Priscilla, she's really mad at me now, I'm making her come up here. So So it was an effort to raise just overall awareness of good, healthy lifestyle choices. We rolled it out quickly because we wanted to get the vaccine message out wrapped in this hashtag House and Healthy. So when I say it didn't roll out the way it was supposed to roll out, it's because I said we don't have time to dot all the I's and cross all the T's. Yeah, I'm gonna over a couple of them just for this. I didn't mean for it, I'll hold it. So again, we pushed it out quicker just to kind of wrap this around the vaccine, because I believe vaccines are part of a healthy lifestyle. So at this point, it is more of a social media campaign. So I would encourage you, if you do social media, if you don't, you are probably wondering, hashtag, what is that?
Pound sign.
It's a pound sign.
Number sign on your
It
phone.
is not pound house and healthy. Please. Please don't go anywhere and say that.
Good point.
That's a free one. I won't charge you for that one. It's hashtag house and healthy. So if you are out walking the dog or walking around the neighborhood or going to a gym or choosing a salad at a restaurant instead of, whatever, ice cream or whatever, take a picture, put hashtag house and healthy on it and post it. So it is a movement. This is not just your typical billboards, although you see this on billboards and other areas, you'll see it in print as well, but it is a social media driven movement. So we're trying to raise the awareness in the community of good health, good healthy lifestyles, good healthy choices. That's where we are right now. Ultimately, though, this can go into the businesses. So we'd be very interested in talking to all the different organizations in our community about using this branded hashtag House and Healthy in your organization. Maybe on the somewhere on the cafeteria line, and maybe the schools and places like that, or at the base, or maybe a little smaller version of this, obviously, on your menu at a local restaurant, if you have healthy options, things like that. And then ultimately, you'll start to see where we offer services in the community. Hashtag House and Healthy. In our Educare department, just down the hall here, where we do all kinds of healthy lifestyle education classes. Hashtag House and Healthy. And then, again, chamber meetings. Let's talk business. We'd love to sit down with you and talk about how our organization, our physicians and physician networks can help your employee base improve their overall lifestyle choices, but also, guess what? Your benefits spend. Hashtag House and Health. We're not there at this point, but this program will grow and will be a social media platform where we can work with individuals, encourage health in the community, but also it's a discussion point for businesses and Houston Healthcare to have a discussion about the health and well-being of your employees, your benefit costs, your benefit options, your benefit plans, our services at the hospital, anything you can imagine is hashtag Houston Health. So please feel free to use this on your social media pages if you're out and about. It's wide open as to how you can use it in your life. So please, we encourage you to use this. We're excited about this. We've moved it along pretty good. It's starting to get a good bit of visibility, but again, I asked that we rush it out quicker than normal just to be able to put the vaccine touch to it. So that's hashtag House and Health.
Excellent. That's a great idea, and I'll take this opportunity to say, if y'all need any healthy model bodies, we'll talk about it after. Don't worry about it. Marketing team. So, I think we may have time for maybe it depends on you, one or two questions. We'll see. During the last in-person meeting, you mentioned partnering with a medical school. Can you give us an update on that?
Yes, that's another one where the Trinity Medical School had a grand opening for this, but so back when we were last together, we were entering an arrangement with Trinity Medical School. It is in St. Vincent's, the Grenadines is where they are home base with their first and second year medical school training. Corporate offices are actually in Atlanta. And their third and fourth year training historically has taken place in Baltimore, in 2 or 3 hospitals there in Baltimore. They have come across Houston County and are attracted to Houston County and approached us about starting a medical school 3rd and 4th year in Houston County. So on the other side of this building is their main local medical school campus. They use the local physicians for faculty. When fully deployed, all of Baltimore operations will be coming to Houston County. So that's as many as 250, 300 students that will be coming consistently through Houston County, using all of our services. And they'll be here for a 2-year period. So it's a fantastic economic development. It's fantastic for us in terms of sort of priming the pump of resources and human resources down the line. The building behind the CTTC building and the Max Fitness, you probably wondered, I've seen a little chatter myself about what's going on there, what's the big project. That is a dormitory project that will service the growth of Central Georgia Technical College students, but will also house Trinity Medical students when it is fully deployed. So what you see coming out of the ground right now is a lot of the infrastructure for both phases of that project. But to begin with, they'll build out one phase. There's some 250 units there, that dormitory units for those students, specifically reserved for those students. And then the second wave takes it up to close to, I believe, 500 units, ultimately right there on that property, and will again service Central Georgia Technical College student growth and Trinity Medical School growth. And then those two entities are also collaborating together to provide additional training access points for Trinity Medical School in the CTTC Sonny Watson building right there adjacent to the dormitory. So it's a fantastic project for us in this community to further develop our medical education and our overall higher education industry in Houston County. I couldn't be more proud of where that's going. The look and feel, if you've seen some of the lofts up in Macon around Mercer and downtown, that's going to be the look and feel of those dormitories, and the outside will sort of match the buildings there around that area. So just fantastic growth and project for us.
Folks, that's a big deal. I mean, we're talking about a partnership agreement with Central Georgia Tech, Dr. Ian Allen. We're talking about Charles Briscoe and Houston Healthcare, Trinity Medical School, local developers bringing business into our community, students. Talent. There you go, workforce. Thank you for all you do. I think I may have to get down, or April's going to snag us, but Charles, thank you and your staff and team for all you do. We really appreciate it. Thank you for your candid comments, being very transparent as always, and we hope that we can continue to support you and your team going forward.
Thank you. Thank you for your time.
Well, as we go ahead and wrap up here in just a second with a couple of announcements and things. One thing that's just caught me off guard this whole time, or through this whole, I mean, in a good way, but just thinking about how on top of all the COVID stuff these last 20 months, they've still been delivering babies. I mean, my wife had one last April. They're still doing emergency services. They were doing all these things. It seems like it would have been an overwhelming task with just COVID, but yet they still managed to do all the necessities. So we just appreciate y'all so much. Thank you for that time today of saying all these things and giving us some better insight. But, and we did start out wishing happy birthday to a couple of gentlemen. There are other birthdays. Apparently it's Councilman Evans with Centerville, his birthday too. I don't know where he is. There you are. Good to see you. But I'm sure there are many others. Your aunt has a birthday. Somebody's got a birthday. But we do. April's joke about the arm wrestling didn't work with more than 2 people, so we weren't able to announce the rest of them. But we won't sing happy birthday again. I wasn't that good the first time. But again, we thank you for coming. It's been a good morning.